Hi, I'm Elizabeth Pisani-Woodruff. This is my videotape assignment for Brian Flynn's general practice class. I did receive some information about the client I'm going to interview with. Just a couple things. I'm actually interviewing with the spouse of a gentleman who was in a car accident. So he does have some physical limitations medically. But this meeting was called by one of the physicians of the patient because the spouse is in need of some emotional support. I don't have any exacts on children or anything like that. I do know that the patient and the spouse are in their 40s and we're pretty much meeting for the first time. I did meet the client I'm about to interview briefly in the patient's hospital room, but this is the first time I've had an in-depth conversation with them. So, okay. Hi, are you Chris?
I am.
Hi, I'm Liz Woodruff. I work for UHS.
Nice to meet you.
Okay. I'm part of the care management team here at the hospital, okay? This meeting was called and set up by the physician, Dr. Hayes, that's working with your husband. We were just kind of trying to anticipate maybe some emotional support for the family at this time. So we did want to set this up. I know you had mentioned to him you had some concerns. So that's pretty much what I'm here to do for you now. Is Chris okay if I call you that? That's okay. We have about 15 minutes for this meeting, so I just want to give you that heads up. And this is really about you, okay? So that's why we're meeting separately. And I just want to establish that everything you tell me here is going to be between the two of us, okay? So you can have that trust that nothing leaves this room unless you want it to, okay? So why don't you tell me a little bit about what's going on?
Well, I mean, it was, I guess, heck, I really haven't slept much. I'm trying to think, like, how many days ago it was. I guess it was, like, two nights ago. He was coming home. He had been out. And then he had this terrible car accident, and I got the call from the emergency department, and the social worker, I think his name's, like, Victor or something, and he asked me to come down, and that's, like, kind of terrifying, you know, like, because he's like, you know, like, well, like, what happened? And he's like, well, we just really need you to come down here, and so, and, like, we have kids, and they're in bed, and they're little, like, they're only, like, you know, 5 and 7, and so we don't really have any family in the area, so that got a little tricky, but my next door neighbor is kind of cool, so I quick ran over to her house, but it was like 11:30 at night. It was kind of awkward, but I don't know. So I came down, and he was like pretty messed up. It was gross, like it was bad, and so yeah.
Kind of a lot for a few days, huh?
Yeah, it's crazy. You know, I don't know. So, like, what do you need to know?
Well, I mean, the medical piece, you know, I can always check in on that, you know, after or another time. So I don't need any specifics with that unless that's something you want to share. What my concern is for us meeting, I want to see how you're doing and maybe try to help with any needs that you might have. So I know you mentioned you have 2 little kids. And you do have a neighbor that's kind of stepping in. Are they helping with watching them so that you can be here, or what's kind of going on with that?
Yeah, it's kind of tricky, you know, because like I said, it happened like a couple days ago, and you know, so I was here, and then I kind of I stayed all night, and then I went home in time to, because you know my neighbor's like, she's got to go to work, so I came home and I got the kids to school because they both had to go to school, and then I was trying to explain to them that, like, their dad had an accident, and
This is at school.
yeah, like, you know, before school in the morning, and then, you know, to try to figure out what to do, and, you know, they were, like, they're scared, you know, like, are you gonna be okay, and they really wanted to come in, but, like, they were still, like, and he is gonna be okay, like you said, you can look at all that chart stuff, but it's gonna be a lot, like, he's got, you know, they said he has to go to, like, rehab and stuff like that, because he got hurt pretty bad, and like some broken bones and things like that. So So, but I didn't know whether really to, should I bring the kids in? Like, they haven't seen him yet. I talked to him on the phone.
Well, and you know, this is a decision that's entirely up to you and what you want to do. I mean, they are little, but I do know he was moved out of the emergency room, correct? He's not in a regular room.
Yeah.
Okay, because sometimes the emergency room can be a little too much. So that's really your call. I think, you know, I see both sides of that. So I think it's important for them to see their dad, and maybe that might help you as well. But if you don't think they're ready and you're not comfortable with that, that's okay. But keep in mind that if that's something that you want to do, we have other social workers on other floors. We have a great nursing staff on the floor he's on as well. We can pull people together to kind of support you. That way, if the kids need to leave right away or they want to stay and you need a minute, we can kind of help you come together and make sure we have some supervision too to help you with that so that they are able to come in if that's something you want to do. And you know what, if you don't want to do that anytime soon, totally fine as well. So just let one of us know. And I know the nurse on the floor has all of my contact information. So if I'm not around and this is something you need to talk to me about or we want to set that up, let her know because she can call me as well. Okay. But yeah, that's a tough one with the kids, but it's entirely how you're feeling about it. So.
Yeah, I don't know. You know, he got pretty beat up, so he's got some cuts and some bruises, a lot of bruising, you know, because he didn't have a seatbelt on, he was driving too fast, you know, he's been out, you know, he drinks, like it's his deal, and, you know, I told him it was going to happen, you know, but he thinks he's like, whatever, so, but, you know, so then trying to even explain to the kids, like, how it happened or why it happened, and, you know, they see him drink and all that jazz, but, you know, it's his deal, but he's kind of a mess, you know, like, in addition to just, like, being in the hospital, he kind of, you know, is all cut up and stuff because of where the glass, you know, cut his face and, you know, on his arms and his hands and stuff, but yeah, so, I mean, I just try to, like, get the kids off to school, you know, because they're, like, first and third grade, and then, like, go back to the hospital because, you know, like, the doctors are, like, in all kinds of times. I never know when I'm going to see them.
Sure.
Find out what's going on, and I try to figure out, like, this rehab thing. They said someone's going to come in and, like, meet with him and see if he's appropriate or whatever that means. I mean, like, when we say rehab, are they talking, like, physical rehab or, like, for his drinking? Like, what do you think?
They're initially referring to like a physical rehab because they know that walking might be an issue for him initially. So they're referring to physical rehab, and there's tons of stuff they can do in the hospital as far as PT, like physical therapy stuff. So they'll get that started while he's here. If the drinking is a big issue, I mean, we can deal with that as well as time allows, or as he allows as well. So if that's something that we need to tend to, we can too. It's going to be mostly up to him, I'm sure you know. So, but there are a lot of supports out there for the family, you know, the spouse, even the kids too, if this is something that you have to live with.
Yeah, he'll have, it's, in his mind, it's not an issue, and I'm just, like, uptight about it because, like, nobody in my family drinks, so he's just
Right.
like, you know, you just worry too much about it, it's not your business, and, you know, you need to, like, loosen up or whatever, because I'm, like, too uptight about it, and that's it, something's gonna happen, you're gonna hurt yourself, you're gonna hurt somebody else, and I just, you know, I don't let him take the kids, because that's the one thing, I'm like, that's where I draw the line. Like,
Sure.
if he's been drinking and he gets really pissed off sometimes when I won't let him, like, run them to the store or whatever, but that's what he does to himself, he's gonna do, but kids have to be safe.
Yeah. Well, I'm proud of you for recognizing that, because that's huge, and I think that's hard sometimes with a spouse relationship. But that's really smart, and I think that you're in the right direction for sure, at least making those decisions. And a lot is coming together right now, and I'm sure it's really overwhelming for you. I think anybody in this position would be feeling a lot of how you're feeling. You know, so keep that in mind.
Yeah, it sucks.
How are you sleeping? Are you eating?
Yeah, I go to, like, the cafeteria or something, but it's kind of tricky because, like, you know, he's supposed to be at work, he's not working, I'm, like, here, which I have, like, some sick days, but, like, they said that, like, he's not going to be able to work for a while,
scary. How are you feeling right now, just thinking about that?
Oh, I'm pretty freaked out. Yeah. Yeah, I don't know what. Because like I said, we don't have any family or anything around. And, anybody that we're kind of like, even used to be friends with, he's just kind of, he gets drinking, he's kind of a jerk. So, I have like a brother and his wife, but they're like a couple hours away. And there's probably nothing they wouldn't do for me or the kids, but they're like, if you're with him, we're not doing anything. Like, he's an ass, so. And my parents are out of the area. His parents are both deceased, so they're not around. But, so it's just kind of like there's not really like. So I talked to the school about it because I don't really know what to do. 'Cause if he's out of work for a long time, we're going to be in a pickle. So.
I'm sure that's overwhelming.
Yeah, it's a little freaky.
There are things we can do with that, though. I know New York State has disability and whatnot, so, maybe once we get through this first stage with his hospital care, we can certainly help you look into disability pay, even short-term disability, because something's better than nothing, and see what we can find out there for you. There's also a lot of other services that people don't know about. Some of them I never even knew about until I was looking for them. So we definitely have stuff like that, child care, access to food, and stuff like that. So if any of this is coming up, and it might or it may not, keep in mind that we can help you with that. We have a very team-based approach here. So our physicians, our nursing staff, and our social work team, we really want to come together to make sure not just that he heals okay emotionally and physically, but that the family is doing okay emotionally. You did note that you don't have a lot of physical family support around. So we can help try to supplement that through this process, and even after that, like I said, to kind of anticipate some of the stuff you might need. So keep that in mind as things come up. If you need to jot them down, that might be helpful too, so that when I do see you again, if I do see you again, you can kind of run through these things with me, so we can address some of those and kind of chip away at a couple things to help relieve some of that anxiety, because I know how overwhelming it can be sometimes when everything's kind of coming at you at one time.
Yeah. Say I didn't want him to come home, what would happen?
Well, I can assure you this, he does have quite a few days, if not a couple weeks left in the hospital. So that can give us some time to process what the next step is going to be. But we can certainly work with you on what you want the next step to be. Maybe you want to relocate out of the home you're in, or maybe you want him to relocate. I'm not really sure what your objective is. But we can certainly start working that out for you to kind of figure out another plan. Maybe, because
Somebody else from your department, I don't know what her name was, but there's been like a bazillion people coming in asking me questions every day. But she asked me about like how many steps we have to get into our house, and this and that. And what I just really wanted to say to her is, please don't send him home, because like I'm just worn out. I'm worn out on him, and I don't want this anymore. So like maybe this is like the best time to just make a new plan.
that's certainly an option that we can explore further. I've been through something similar, so I can understand that kind of fear of repetition. So, maybe this is time to make a change. So I can say the hospital side of it, they're going to want to rehabilitate him, get him nice and ready, and then to get him home as soon as possible. So since I'm here for you, and our relationship's important, what I can kind of do is be a little bit of a liaison between the two situations. So let me see what I can do on that end of it. First thing I can do too is kind of see about how long we have left as far as his recovery. Sometimes that stuff is super question mark. We just really don't know how long, you know, if this is gonna be okay, things pop up medically. But let me see if I can get a ballpark on that. And then let's definitely explore the next step together, because I'm with you on this. And together we can really work through this to give you and your kids maybe a more healthy environment, if that's something that you're looking for. Alrighty, so is there anything else that you can think of that you might wanna?
No. I mean, we'll just have to, depending on what you find out, we'll just have to figure out how to tell him, because he pretty much assumes he's coming home, so we'll have to figure that out along the way.
I mean, the other thing too you gotta keep in mind, he's on a lot of medications right now. He's going through a lot of physical stuff and the medical stuff, so that's gonna fog him up, you know, for lack of a better term. So we can work on this exclusively separately, you know, and like I said, there's great support groups out there. There's Al-Anon. These are great things for the family to attend and help you establish your role in his issues with drinking too, and kind of empower you guys to make a change and see where you want to go and what you want to do as well. Because we certainly want to have the most healthy environment for all of you, you know, so if we can do this amicably, great. But we're going to be with you at every step of the way. We can do this as a team, so you just hang in there. But in the meantime, really try to sleep as much as you can. You know, make sure you're eating too, because your kiddos are going to need you. Yeah. So, and if there's anything like child care or food or anything that you need in the meantime, give me a call. I know I left my card in that file we gave you. You can call anytime, leave me a message, and if I don't get right back to you, let the nurses know they can find me as well. Okay?
All right, thanks.
All right, it was a pleasure.
It's nice to meet you.
All right, thank you. Okay, I don't know if that was